Do you know why you should care about your joint mobility? That pesky little pain that you have could be that you have limited joint mobility. And because you have limited joint mobility, your joint isn't moving as efficiently and now it's gaining inflammation. And if you're a woman over 40 and maybe your estrogen's going down the toilet, your estrogen helped you keep flexibility within those joints and helped lubricate your joints. And also it helped your bone density and muscle mass. And now I need you, even though you didn't have to do this before, you have to do mobility to protect the integrity of your joints. All that stiffness you feel is limited mobility within the joints. I know mobility also means your ability to move around, say your neighborhood. That is mobility. So it has two meanings. And mobility can look very different based on what you like. It could be sun salutations. It could do yoga routine that is a long 1 hour routine once a week. You could do a daily 10-minute routine, which is what I generally recommend. If you want to see what my mobility routine is, it is pinned at the top of my page. I have been working on my knee mobility and my thoracic mobility and my hip mobility because as I have entered perimenopause, those particular joints are really bothering me. But because I've been consistent in my mobility, I have gained motion. Now, I also love my vibration plate to help my mobility of my knees, but that's me. I personally enjoy using my mobility plate because it helps me with my joint pain and it has helped immensely with me walking down the stairs in the morning and I have less pain. The reason I talk about a vibration plate, it is what I would jokingly call low-hanging fruit and one of the easiest ways for people who are nervous about exercise to start. Now, mobility plates are not for all people. Some people who have severe SI joint dysfunction, if you had a knee replacement 6 months ago, if you're immediately postpartum, if you have issues with your eyes and are at risk for retinal detachment or have a family history or you've had history, you don't need to do a vibration plate. But I am a normal mortal who became a stiff chick during perimenopause and I got really sick of joint pain and I already do a lot of things and this was a complementary therapy for me. But I've already been doing my mobility routine. I am doing it consistently because that matters, and then adding in the vibration plate was one way for me to up my game and help my pain relief. So think about what's hurting you and let's make a mobility routine for you.